Welcome to a new episode of How to Handle This Situation. As a phlebotomist, it is essential to know how to properly handle certain scenarios that you can face while drawing samples. Aside from knowing by heart the process of drawing samples, knowing different strategies to calm your patient and let you do your work is a must. For today, we are going to show you a scenario that will definitely test your patient, and of course, your knowledge and common sense. Just sit back and relax and let's learn together.
Batang kuhaan? Sige, kaya rani, naabito ang bantay.
Mayong buntag, ma'am sir, tagalabday ko. Magkuon ta kog dugo kay nag-requested ako og mga test ug kinahanglan sad magpasob ang bata para sa rapid antigen testing.
Dili na siya sakit kaayo, ma'am. Paspaso jud ba ni siya mohilak dugay kaayo pahilumon. Sensitive ra pud kaayo siya sa gamay ra na sakit.
Ay, naara siya mabatian na gamay nga sakit, pero kadali raman, mawala pud dayon.
Sige. Paspasira siguro ma'am para paspas rasad mawala ang sakit. Sharpshooter baka ma'am. Basig di dayon nimo makita ang ugat ba. Luira kayong bata.
Tanawon ra nato sir, di pud ko maingon na sharpshooter ko, pero testingan ra na kog isa ka tusok lang.
Basig dili nimo matuslok sa ugat ba nya magdugo ang kamot sa bata. Ayaw na lang siguro kuha iday.
Kaya man kuhaan sir, kinahanglan sad kuhaan og dugo ang bata kay request ni doc. Ngayon ra kog tabang kung pwede gunitan lang sa ang bata kay basig mo fixi. Dili lang ta banda ma'am sir. Hindi mo po dugo. Ha, gamay naman yung sakit. Gamay na dyan yung sakit. Paspas na po niya para maayon na ka.
As you can see in the scenario, both the patient and the parents are anxious. The pressure from the parents can affect the child's behavior and the medic's performance. That is why, in a situation like this, the phlebotomist should ask the parents or the watcher to step outside and let her do her work. Of course, ask for the help of a nurse or a fellow medtech to restrain the child if ever. Also, that person will serve as your witness inside the room.
Hawa na lang sa guro mo, ma'am sir, para paspas na lang po siya makuha ng dugo. Ang baka ang dugo, bigyan kita ng candy. Candy? Here. Candy. Isa mo na ngayon, tapos kapag magkakuha ka, yan ako lahat. Ay na.
Doing the order of care properly has a profound impact on what care the patient will receive. It is important to maintain the proper order of draw to avoid contamination. If the order is not followed, there is a possibility that the additives in one tube will be transferred to another tube, which can bring inaccurate results. The procedure shows how the phlebotomist draw blood from the child using the butterfly needle and evacuated tube system. The phlebotomist uses butterfly needle because the patient is a child and the veins are small and unstable. Because it needs to draw more than one sample for the test required, it will be utilizing ETS. The red tube is to be transported to the clinical chemistry lab for determination of potassium and sodium level of the child, while lavender tube is to be transported in the hematology to determine the complete blood count and platelet count of the patient.
A nasopharyngeal swab for rapid antigen test is a test conducted to know whether a patient is COVID positive or not. In reality, examiners are ought to wear proper protective equipment to avoid contamination.
As you can see, a phlebotomist's job is more than drawing blood samples. It requires a lot of knowledge, patience, and common sense. In order for you to be a competent phlebotomist, you should be able to think fast and handle different situations. This is just one of the possible cases that you will face if you are planning to pursue a career in medtech. Remember, not everything that you have to learn is in the book. Sometimes, You just need to think critically for you to be able to deliver your job effectively. Once again, this is a new episode of how to handle these situations, and I hope you get some insights in today's episode.